Business World for inviting me to moderate this panel on health insurance, which I think is such a critical issue affecting pretty much every citizen in the country. So I'll just, before I get to the panel, I'll just start with a short story, which is a patient story, because that's why I think the entire healthcare sector and industry exists, is for the patients. So there is a patient who's had a serious chronic condition for the last few years and has access to a private health insurance, a leading private health insurance. Initially, it was a struggle to even explain to the people on the insurer's side in terms of the condition that this person is dealing with, the kind of treatment they're on, because the kind of treatment that the company expected was very different from what was now being given to this person. And then, because it's a chronic condition, so month on month, there are claims that get generated. But it's been a very challenging process, to say the least, and this person has only one caregiver who, to put it in her words, says it's become a full-time job for me, just to, have this constant back and forth with the insurance company, very legitimate claims certified by the doctor, but even then they're rejected sometimes for absolutely no reasons, or very frivolous reasons, like documents were not submitted when they were actually submitted. So this story I just wanted to share up front, that we talk of a lot of progress, and undoubtedly we made a lot of progress, but we still have patients out there like this. And for those in the audience who might not have guessed, or who might not know, this patient is me. I suffer from a rare cancer called ALK positive lung cancer. For the last 2.5 years, I have been dealing with this. The caregiver here is my mother, who's nearly a 70-year-old senior citizen, who has to struggle with these insurance claims almost every month, perfectly valid claims. So if this is happening to me, somebody who's relatively, I would say, privileged on the awareness side, on knowing about the health sector, getting a leading health provider, insurance provider, we have a lot of concerns for the rest of the population. So just wanted to set this out, but of course we'll talk more about the challenges. I think initially I'll come to my panelists and request them to share their opening thoughts on where they think that we've really progressed when it comes to health insurance, but what are the current challenges we are facing, and this can be public and private insurance that we can talk about, and certainly I'll add to the public insurance bit later. So if I can come to you first.
Thank you, Dr. Urvashi. So I'm also a caretaker. I'm a caretaker side. So my mother has glioblastoma stage 4, which is brain cancer, since October 24, and I'm also similarly struggling with the claims. So we started with the surgery, and post that robotic surgery was recommended, which is CyberKnife. Even the doctors were not sure if the claim would come through. It was about 5 lakhs for some sessions. And it was tough to explain to the insurer that why not just the conventional radiation, why are you going for CyberKnife? And I had the knowledge, so I could fight for the claim and get the money. Later, in brain cancer, oral chemo is given, though approved by IRDA, but I struggled with the TPI explaining them that this is oral chemo, this does not require admission, it has to be taken in tablet form at home. And this is an expensive therapy every month. So every month there is a fight with the TPA DAS that, chemotherapy is covered. Every time I have to give the IRDA circular to them to explain that, please pay. So these are the struggles which caretaker has, and I totally agree with Dr. Urvashi that it is a full-time job. Sometimes we do delay submitting the documents because we are caretaker. We have to take care of the patient. Especially in cancer, there are a lot of side effects, a lot of struggle, food and everything has to be managed. So we are not able to submit the documents in time, though there is a clear guidelines by IRDA that delay of submission should not lead to claim rejection. But still the insurance companies are rejecting claims saying that the documents are delayed. And then since this is me, I know, so I can fight it. But for the common person to understand these protection that IRDA has offered, I don't think they have, and that is why we are working on the policy holder side. I am representing Insurance Samadhan, where we help the policy holder with their claim rejection, claim delay, and short settlement. There are also a lot of cases where insurance company do not pay the entire claim. They do some deduction, for a 5 lakh claim, they may pay only 3.5, and this common person does not understand, the caretaker does not understand what are the deduction, are they fair, are they not. So they come to us and then we help them. So this is about me, my journey and Insurance Samadhan.
Thank you so much for sharing that. And I think you've highlighted a very important point about awareness also. That while you might be aware of, provisions or things that have been put in place to protect, a consumer or patient, but the general population might not be aware of that even. So I think that is an issue. And of course, like you also mentioned, which I've seen in my case also, that treatments have advanced. Now we don't always have the typical stereotype of a cancer patient admitted in hospital getting that chemotherapy. I mean, I just took my tablets this morning and I came here and I'm sitting in front of all of you, but I'm still very much a cancer patient and I still have very legitimate, claims. So I think that mindset is not just an insurer's problem. I think everybody has to change that mindset. Frankly, even government insurance, I would say, is lagging behind in that because even they are covering very age-old chemotherapies. Some of them are not even covering the more advanced, targeted therapies. So I think it's a mindset issue for all of us. And with that, I'll come to Jitin to get your thoughts, please.
First of all, thank you for inviting me here. I think very adequately said that when it comes to claims, there can be a certain level of subjectivity. And what I would like to say that in the last couple of years, I have seen a lot of efforts put by regulators, especially IRDAI, on this front, in order to make this insurance more flexible and more affordable for the people. And I think the COVID has been the defining point for us. Before that, as a young professional, even I was not fully aware about health insurance. We used to rely on corporate insurance per se, and many a times when some specific event strikes, especially event like cancer, so your corporate insurance is never sufficient. So first of all, COVID has been an eye-opener for us in terms of creating that awareness. And what I have seen in the last 1 hour or so, there has been a lot of efforts going in that front. For example, how to make insurance products more compatible, more customizable for different needs of the customers. It can be and to open that for the broader segments, not only someone who is in tier 1 having a good income, or and also for the people who may not have that kind of disposable income at their front and how to make them affordable for them. So I will touch upon that briefly, but yes, affordability has been a challenge, and there is a larger segment in the society, especially in tier 2, tier 3, underprivileged, which do not have access to that, and there is a lot of work that needs to be done. And if I say there have been some strides in that direction, and when we say that insurance for all by 2047, there is a commitment that is being shown by the government and the regulators. And when it is shown, and recently we saw 100% FDI in insurance, so I would say slowly but surely we are moving in direction where the customer centricity approach is there, and that becomes imperative for any insurance company to play in the market. And as it goes, and as more digitization, as more technology comes into the picture, I would feel that there's a certain element of subjectivity in claims which is there, and as you talk about, will also come down drastically. But there is some gap to be covered, but surely we'll get there in next couple of years. That's what my thought is.
Thank you. And I think you spoke about different groups a little bit, and we'll talk more about that. I think especially in insurance, I know that when I was at NITI Aayog and we were working on Ayushman Bharat, we constantly pushed for insurance for this missing middle as well. Because it's not so you have things for the bottom of the pyramid, which rightly should be the first priority from a government point of view. And then the top of the pyramid can take care of itself, but there's this large missing middle, who are still people who might be self-employed, entrepreneurs, various people who still might not have access to health insurance. So we had actually proposed, and I think that's still very much under consideration, to expand some of this cover even to this middle income. This time we saw something for gig workers, for instance, being announced in the budget. But I'll come back to you for more thoughts on that. So Shilpa, coming back to you, I would say that, you mentioned that you help, through the organization you represent here in terms of the claim aspects. So where do you think that we really need improvements in those processes? And you mentioned awareness, I think, which is so true. But on the other side, is it also a capacity issue? Is it, like you said, an understanding, ability to just understand where have treatments evolved to? So what do you think are those real challenges that, we need to address?
So first, on the insurance side, I feel the training to the seller is missing. So there, in the policy for these modern therapy, there are sublimits which ideally should not be sold, because medically we are advancing and a lot of robotic surgery and modern therapies are coming. So if I have a sum assured of 10 lakh, then there should not be sublimit, and I should be able to avail whatever treatment I want to avail under modern therapy or robotics, or all the advancement that is happening. So the seller is somewhere not doing the right thing in terms of educating the policy holder as to what product they should buy. People are generally, I've seen people are afraid of robotic. They say, no, robotic nahi, will go to the doctor. So this needs to be explained to them that robotic is not that the doctor is missing. It's just that, it's a modern way, and it's more targeted and more specific kind of treatment. So these are certain things where the advisor has to learn how they are selling the product. And on the consumer side, it's very tough to say that they should be more aware, because IRD is regularly working and releasing a lot of guidelines, customer protection, but to know it all is difficult. And I also feel that we buy insurance now and we are not sure whether the claim will come, we may understand the product now, but the claim may come after 10, 15, 20 years. I may not remember the product benefits that are there. So that regular update from the insurer as to what are your coverage, whether you want to enhance, or those annual reviews needs to be a part of the system, which is the insurer are also struggling with it. But as an individual, we need to understand that we need to undergo an annual review of what we have, what kind of coverages we have, and what are the benefits, what are the enhancements that I can do in my product. So these are certain things which are missing. And as I said, awareness both at the seller and the policy holder end is required.
Yeah, thanks. And I think just a quick follow-up on that, if I may ask, because I am seeing this now, for the last 2.5 years, month on month, like you also said, you've also seen it as a caregiver for some time now. For people who have chronic conditions, because even now with cancer, I mean, there was a time when if somebody has stage 4 cancer, we would kind of dismiss it as, this person's going to die any day, and so we don't really need to plan anything for them. But we've come to an era, thankfully, where even people with stage 4 cancer could survive for many years. So they could be doing this, day in and day out. How do we really simplify, how do we streamline for them? Because they are not the one-off, claim submitting people, or, once in a while, or maybe sometime. They're just literally doing it, on the go. So what can we do to kind of think for those kind of people?
So there are digital apps available for certain companies for submission of these bills. The smaller bills you can submit online, but again the awareness is missing. we still go the physical way, fill the form, and go and courier or submit the documents to the insurer. So I think insurers are also working and IRD is also working. As per our data, less than 18% people actually file reimbursement pre-post, or for the, even I don't file every time because it is cumbersome, and I am with a public insurer, my mother, so they don't have those applications where I can file. So physically we have to submit. With my working schedule, I sometimes give it up, it's okay, let it be. So it is, the cumbersome process needs to be broken into digital form. I would only suggest that hospital can also, directly do it with the insurer, send the entire documents and ensure that the policy benefits that are there is paid to the policy holder. So that kind of integration can be done between the insurer and hospital, because actually we are taking treatment there. The pharmacies are there in advanced hospitals. So somewhere some integration is needed.
Okay. So Jitin, coming back to you, the same question, if you have thoughts on that, then please do share in terms of how we can streamline, simplify, and this constant, rejection happening. Then you again go to your doctor, you get a letter, you again submit it. Because I have myself, my poor mother has had to do it so many times, and I'm with a leading private health insurer. So that's something that your thoughts would be welcome as well. And then on the missing middle part, if you can further elaborate, what we can do better, including the government. What can the government do better? Because, like I said, we've been thinking about expanding Ayushman Bharat. So is that the solution? Do we need more things? Your thoughts on that?
So on the first on on the claim side, one thing which I would strongly advocate is to buy any insurance policy early in your life. So what happens is that when you are 25 years old, 30 or 35, you think that you are completely fit and fine, and there is nothing gonna happen, and there is no point putting it as an expense. But insurance policy, first of all, should be seen as an investment into an event which can happen in future, and it can be any event. It can be a small event, it can be a large event, and such kind of events do not come without informing you. And the benefit of buying a policy early is that by the end of 3 years or 4 years, you are completely off from all the waiting periods, which might or might not be there applicable for you. Moratorium period, which is 5 years now, and after 5 years, no claims can be contestable. So if you, initial 4 to 5 years, if you have gone through that journey early in your career, early in your early in this journey of buying the policy. So what happens is that after that, any claim journey can be simplified, because once you submit your papers to the TPA desk, once you are in hospital, then the underwriter also knows that there is a history that you do not have any waiting periods applicable to you, and the process of claim processing becomes easy for them. But what happens is that when a particular insurance policy is bought, when you have that disease near to the buying of the policy, then it goes into investigation, and sometimes it takes time, sometimes it requires more investigation, more evaluation of whatever you're going through, and then where there is a lot of subjectivity that comes into picture. So my suggestion would be is to buy the policy early. That will free you up from a lot of hassle that brings in when it goes to claim. And coming to the simplification part of it, there is a lot of guidelines and lot of initiatives that are coming in the last 1 year. For example, if you are admitted in a hospital, so there is a clear idea guideline that the insurance company has to clear the initial authorization in 1 hour and the final authorization in and final discharge in 3 hours. So that is the mandate that I have given. And the one leg which is very important is that the hospitals need to be more agile in submission of documents. So what happens is that as soon as a doctor says that a patient can be discharged, it many a times takes 3 to 4 hours for the hospital to prepare a discharge summary, send it to the TPA, and then the TPA trying to get a final approval from the insurer. So while there has been a lot of guidelines which has come between TPA and insurer, but there has to be some simplification of the process which has to happen at the hospital and itself, where the discharge process becomes simplified. And on the reimbursement part, I know that historically it takes a lot of time, But recently, after all these guidelines, some of the insurers are trying to create an insta reimbursement kind of a process. So where they know that for certain reasons, maybe the patient didn't go to the network hospital. What they are trying to do is that for the simple cases where all the documents can be available to them within the matter of 24 hours, they are trying to endeavor to pass those claims within a matter of 24 to 40 hours, provided there are no further queries. So, so there is an intent which is coming up, largely maybe because of regulation, and also the need of the RIs is to be more and more agile in insurance, and that's the way to go forward. So those things are happening from the claim perspective. Having said that, there are scenarios which we also face on a day-to-day basis where there are certain claims that get stuck, where we require more thorough investigation, more thorough push to the insurer in order to have a harder look on those on the details and get those approved. So those challenges are there, but having said that, it should improve over the next couple of years. Coming to the missing middle part, I think this is very important topic. So what has happened is that insurance historically has been available to people who can afford it in a certain premium range. And with the government schemes coming up like Bima Sugam, Bima Vistar, and where the policy rate is trying to be within the range of 2,500 for health insurance, for life insurance collectively. So there is a certain category of customers and the segments which are not in that underprivileged category, and also are not in the category which can pay 20,000 to 30,000 kind of a premium on an annual basis. For that, I would say, first of all, there was an IDA guideline last year to make products more and more modular. So in that, what it means is that these products, there is a base product and then there are riders attached to it. And as you mentioned about the room category and the sub-limits, so what is happening is that there are a lot of variants which are coming up which can cater to different needs. So for example, a simple example, a particular insurance product can come up with the option of choosing only a general ward or a twin sharing room. So not everyone in a tier 2, tier 3 city needs to go a single private room or a deluxe room. So once someone opts for this kind of an option, plus and once someone choose for this kind of an option, the premium rates definitely go down. And secondly, what happens is that traditionally insurance products were designed in a manner that they cover a lot of network hospitals, even including likes of big hospitals like Fortis, Medanta, etc. But someone sitting in tier 2, tier 3 may not opt to go for that kind of an option. So what insurance companies are coming up with is a limited network kind of an option where someone sitting in say Bareilly or a Sangli kind of area will go in the vicinity only. And if they are opting to choose that kind of a network, so what will happen in that process, that the premium can go down by 40 to 50%. And we are seeing that kind of mindset from the insurance companies to bring those variants which specifically cater to tier 2 and tier 3 kind of markets. And so that's the one thing which I would say is really in the innovation state, and plus the flexible option of paying monthly via monthly installments on the quarterly installments rather than the annual installments is also helping customer in order to have those things, have an insurance policy which is affordable and as well as accessible to them.
Okay, thank you for that detailed response. And we just have a few minutes left. I wanted to check if there's any question or comment from the audience. I see Dr. Pandav would like to say something. So is there a mic in the audience?
Thank you so much. Is the mic working? Yeah. I come from a family where 2 members had cancer. My eldest brother had a renal cell carcinoma, and my father-in-law had adenocarcinoma of the colon and later adenocarcinoma of the lungs. So I know what it means for the family. I've known Dr. Urvashi Prasad's case a little better than most of the people sitting here. My question to you, Urvashi, is in spite of all these aggressive approaches, and I'm being polite, how do you manage to keep yourself so happy and so...
I know that.
Oh my God, I love this question. It's a compliment, yeah. I don't know how, Dr. Pandab. I wish I had any recipe or secret sauce to share with anyone. But I guess it's just the spirit to still get up, get out every day and do what I can. So
So
that's what it
that
is.
brings out an important discipline of behavioral sciences, which my pal, we did not learn in medical school. Behavioral
Thank
sciences
you.
is very important. Psychology, sociology, philosophy, economics, political science. That's the missing part in medical
Trust
education.
me, I did not plant this compliment for me in advance. So this is completely spontaneous.
And one important, we practice all kinds of pathies. What we don't practice is sympathy and empathy. तालियां बजाओ यार.
Yes, some round of applause.
And life insurance is actually death insurance. It's not life.
Thank you, sir.
Last one comment.
Yes.
We have to give a comprehensive insurance, including the human beings, but also most important, agriculture and animals as well. So please take this
Correct,
mind,
correct.
take it to your mind from the rural
Correct.
community. Thank you.
Thank you so much.
So, as Urvashi already know, and being a part of the community, Can Hill community, I run. And Can Hill community is something which I'm myself a cancer survivor from third stage breast cancer. And yeah, thank you. So, we are started a community called Can Heal Community, where we are trying to help lots of people not talk about the death, but the life, post cancer. Like Urvashi, I said, like, I know your ingredient of being happy, like dance and all of that, like how positively she come and she inspire other people. But one thing I want to know about, like, I have many people there in the community. It's just not for the, metro city people, but the people who are coming from tier 3 cities as well. So it's very difficult to educate them on this particular subject. Still, kahin na kahin hai yaar, insurance karane se kuch nahi hota. There is a lots of struggle. Though their mother, sister, brother, many people been through the same journey, but still ये insurance कराएंगे तो क्या होगा. So my thing is that because we are into that community building process now, that how we can educate them, because it's not just about the survivor or the fighter who have fighting and been through, but the caregiver, they are also equally at the stake, right? So our agenda is here that we want to educate them and their family on every subject, irrespective of insurance, which is, I believe, sir, it's not that, but it's very important also, because मुझे पता है जब मुझे cancer हुआ था तो it's being my one of the biggest pillar to save me from I can say that cancer से बाहर आने का एक वो भी reason है क्योंकि cancer पैसा ना हो तो इंसान के मरने के चांसेस ज़्यादा रहते हैं. इफ़ आई बी वेरी स्ट्रेट फॉरवर्ड हेयर, सो पैसा एंड द इंश्योरेंस इज़ अ वेरी इंपॉर्टेंट थिंग जो हर एक किसी को कराना चाहिए. सो माई थिंग इज़ दैट अगेन कि आप अगर उस पर थोड़ा सा हाईलाइट कर पाएँ, बोथ ऑफ यू, हाउ वी कैन एजुकेट देयर केयर गिवर्स कि आपके सबके पास एक हेल्थ इंश्योरेंस होना बहुत ज़रूरी है विच कवर्स द कैंसर.
Okay, super quick response. We have that. I'm seeing that that very scary, ticker, and it's under 2 minutes now. Yeah.
So I think you have those stories where cancer patients are struggling with finances. So why don't we share those stories, and maybe we can get involved, or Jitin can get involved with your community and explain them if they have any questions regarding that. We can, because I think what is missing is the trust. Even if people buy insurance, they have that fear that maybe the claim will not get through. So that part I can take up and assure that if you have a genuine claim and if you have declared everything, I am there to support the community, and Jitin can offer the products that are needed because we don't sell.
So we
He's
are
looking
more
a bit
brokers.
reluctant.
No, more brokers. No, first of all, we are not insurers, so that's what I wanted to clarify. But having said that, we have invested very heavily in services, and we are working towards it. And not only for people in India, but for the NRIs who are residing outside, but they have parents in India. So we are trying to bring up those services, and that's really a point taken for us. And we are working hard on that, and we are tying up with our some of the partners in order to make sure that we provide more and more empathy-based services for senior citizens. But early stages, but we are definitely on it. That's what we'll say.
Okay, so
Yeah.
30 seconds.
Yes.
Yes.
I have 2-3 points which are very important to understand for everyone. And I request Shilpa to take care of this. One is the 24-hour stay. Most of the insurance companies, they reject 24-hour stay. In the modern technology treatments, the day care is not required. Point number one. Some insurance company, the cataract or the minor surgeries, the minor hairline fractures, they reject because the day care is not there. Most importantly, for every insurance claims, we have to submit the original imaging reports, test reports, everything. It's very, very difficult to get back from them because the post-surgery, we have to go for doctor checkup, regular, frequently checkups, but the record is there. We are not keeping anything with us. And next is the they take prior approval or claim approval. Most of these insurance companies, they takes hours, and during that hours, we can't vacate the room. The hospital, the day we are in the room, and the patient has to go back to the house. Some people, they are living very far away, they have to go. But we are still waiting for the approval.
Yeah, that happens. It's happened to me
That
also.
Jitin
Yeah.
has already mentioned. So there is a IRDA clear-cut regulation that once you are admitted, 1 hour for the claim approval and 3 hours for the discharge, provided the hospital submits the documents to the TPA.
Yeah.
What I am observing personally is that the discharge summary and the documents from the hospital to TPA is taking more time. So
Yeah, it's almost never
hospital
3
has to
hours.
also,
It takes
you
many,
know,
many hours.
Both are blaming each other. One more point is there.
The patient is just sitting there. I've myself been
I'm
there,
I'm
stuck in
totally-
that
I am
horrible
understand.
hospital room for hours on end, just wanting to get out.
I
And
totally
one
know what
more
you
point
said,
is there.
actually.
Some insurance company says post hospitalization 60 days. Some says post hospitalization 90 days.
Yeah.
What is the clarity?
So it depends on the type of policy you have taken. So
There is no IRDA rules.
there is no rule on that. It is depending on the premium that you pay. So you can, if you take 60 days, premium is less. 90 days, premium is little more.
Star Health says 90 days post. The other says 60 days.
Yeah.
United India says 60 days. So, but there is no law rules on
Sir,
that.
it depends upon the product and the plan, and if there is 60 days, then the premium is accordingly inbuilt in the plan, and if it can be 90 days, it can be up to 180 days as well.
And
So-
whenever you go for an appointment, the first question, are you covered under this? Doctor is busy. No appointments. Private, take next hour.
Okay, so like an exam in school, I can see this in red, time's up. But I think
I think
we've.
there's one question.
Sanjana, you're the boss. If we can take one more, then I'm.
Clarification.
Yes, okay.
Yeah, Dr. Urvashi, the way you claimed your survivor of breast cancer, there is a treatment like proton therapy, which is very high end cost and very rarely used by very elite class. So, do you think this type of is very successful treatment and being ensured by all companies or not?
So I didn't understand the question. Are you saying is proton therapy covered by
Yeah.
insurance companies?
Yeah, it's very high.
I'm not
You need to check because I think
not sure here.
It comes under modern therapy. So anything which is FDA approved, we little have to fight, but I think it should be covered. It is expensive, it should be covered.
Yeah.
Hello.
Okay, so
One question.
so
we
he's
keep
giving
this-
me a different
I'll-
instruction.
only 10 seconds to ask, that's it.
You're
Last
giving
question.
me a different
Yeah,
instruction.
10 seconds,
so-
please ask. That's Samal, it. myself,
Okay.
Dr. A.K. Rajput.
Yes.
You see, all through I have never availed any insurance coverage. But now at this end we got to avail. But I found this is a useless, absolutely useless. Better to deposit whatever money you are depositing in the, this paying the installments policy. Better you keep in the bank and pay as and when it is required. Because they don't pay for silly things. I'm a doctor. Being a doctor, I find my claim was rejected for a very silly thing,
Yes.
and they has no answer. And I was really frustrated. And I go to TPA, to the hospital. I think 80% people are crying there.
Yeah,
If
yeah,
you go to
absolutely.
TPA, see their position. I
Absolutely.
think what is insurance here?
Yeah. No, and thank you as a doctor for highlighting that. I think that's a great point. I think on that note, we'll have to close this session. It's great to see so much engagement from the audience, and I think health insurance is such a topic that is, very challenging, very complex. But we've also heard of some new regulations, new solutions, but we do need better implementation. So let's end on that optimistic note. And today we've just had elections in Delhi. I wish whoever comes into power cares about healthcare, and of course health insurance is an important part of that. But I really hope to see healthcare as a priority, regardless of who comes in. So we'll end on that hopeful note. Thank you, and over to you.